Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
For a lot of men, what starts as a minor twinge in the back can turn into something bigger. Is it disc degeneration, nerve compression, or hormone-related muscle loss? So how do you know what's normal and what's not? I'll have some insights for you as well as answer your questions on this episode of Ask the Doc. No appointments needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Alejandro, who asks, "Hey, Dr. Bru, am I loco? How come it feels like my back pain always seems to feel worse in the morning? My workout buddy says it's probably dehydration, but maybe he's the one who is crazy." Hi, Alejandro. I can't tell you how much I love this question. And in this case, I'm happy to tell you that your workout buddy is wrong. The typical symptom of a degenerative disc in your lower back is to essentially have a difficult time getting out of bed, a difficult time getting up from a seated position. Many patients will say that when they're sitting at the dinner table, they have to keep fidgeting and changing positions often. And then I'll ask them, but when you stand up from, let's say, a long car ride, do you stand up kind of like an old man? It takes you a little while to stand up straight, and reliably, the answer will be yes. So the answer is not to drink more water, is to get you an MRI. I hope this helps. Our next question comes to us from Timur, who reached out to us on our YouTube page. Tim's question is, "Hi, doctor, I'm in my 40s, and as much as it pains me to admit I've put on a bit of weight, and now my low back pain has recently started bothering me. Does weight gain actually have an impact on back pain?" Hi, Tim. Thanks for reaching out and for sharing your story with us. The short answer is no. Your recent weight gain did not cause your back pain. There are really very few reasonably good, statistically sound articles on finding a correlation between back pain and obesity. So your weight gain is very unlikely to be the culprit. But the fact that you are in your 40s, that's where we should look. Essentially, most patients who present with degenerative discs and those classic symptoms of morning pain, pain after sitting, pain that diminishes once you warm up, but then reoccurs once you're standing in your kitchen or standing in line at the store, these are symptoms of degenerative discs. And if you're in your 40s, you're allowed to have those symptoms with or without weight gain. So I encourage you to obtain an MRI, obtain a diagnosis, and don't accept this as sort of the status quo for the rest of your life. You wouldn't do that with knee pain or shoulder pain, so don't let that happen with your lower back either. A lot of people will try to lose weight in order to help them with their back pain. It's hard to discourage that. But if you are struggling through going to the gym, if life is not fun because you have so much back pain, and by the way, losing weight when you have back pain is very difficult, I'm a big proponent of finding a diagnosis. Find out why you are hurting, get an MRI, get a proper evaluation, and then you'll have an easier time losing the weight if that's what you are indeed looking to do, because then you can get back to normal activity, normal workout schedule. I hope this helps. Raymond reached out to us on our YouTube page, and his question for me is, "Dr. Brusovanik, I've been having back pain lately, so I went to my primary care physician last week, and he said that I have osteoporosis. I thought that was something that mostly women get, and what can I do about it?" So Raymond says that he's having back pain and he's diagnosed with osteoporosis. And here I am, like a parrot, over and over again saying you need a diagnosis. we need to know why you are hurting. And if osteoporosis is to blame, then the only way to explain your pain truly is if you've sustained a fracture. So this word diagnosis to me is sort of the banner under which I start my work with patients. In other words, we can't proceed. We're not just going to try this therapy and that therapy until we know exactly why you're hurting. So we obtain an MRI, and with an MRI, we see the health of your discs. We see the alignment of your bones. We look for things that are commonly associated with pain, and there's a great deal of evidence that correlates findings on an MRI with patient symptoms. Now we have other elements, a physical exam, a history of osteoporosis, Raymond's age. All that comes together to find out exactly why you're hurting. And Raymond, unless you have a fracture, I would not just blame osteoporosis. Once we obtain your diagnosis, once we know exactly why you're hurting, we should still address the osteoporosis even in a preventative fashion. Truthfully, it's one of the few things in medicine that is ethical to address in a preventative fashion. One of the few things, because it does make a long-term difference if you can strengthen your bone, as it may prevent you from having more pain from such things as fractures. I hope this helps. Zane sent this question via our very own website, allhealthtv.com. Zane asks, "Hey, Dr. B, I am in my early 50s and thought I was in pretty good shape until recently. I've been dealing with some lower back pain. I went to my doctor who said I have low testosterone. Does low testosterone cause back issues?" Hi, Zane. This is a really important question, and I appreciate you sharing your story with us. So testosterone or lack thereof does not cause back pain, period. That being said, I have a big bone to pick with the testosterone industry. Ask your doctor if he or she is prescribing you testosterone, what's the end point? When do you stop? And my humble opinion is that measurements of testosterone are frequently erroneous because they are frequently done in conjunction with such things as fasting labs. Testosterone fluctuates tremendously, and it's just not a very testosterone-ish time when you're sitting in a lab, starving in the morning, waiting to get your blood drawn. There are other hormones that fluctuate within seconds, like blood glucose is affected by glucagon and insulin. Cortisol levels change momentarily based on you simply getting scared by a horror movie. And you can see how testosterone values would similarly change. So if your doctor is prescribing testosterone, make sure to have that conversation. And by the way, those who have been taking testosterone for a long period of time will attest that this is not a benign procedure. Those who've been taking high doses of testosterone will often report an incredibly high amount of red blood cells, which may sound like a good thing to have in your blood, but it does predispose you to blood clots. Please talk to your doctor if you've been taking testosterone for a long period of time, and ask the doctor, what is the end point? When can I wean off or stop? I hope this helps, Zane. And I hope that you, like so many of our other callers, get to that core of the problem, the reason why you're suffering, vis-a-vis find your diagnosis, get that MRI, get evaluated by a proper specialist with a good physical exam where all your questions will be answered, and then you'll have a legitimate chance of getting better. The next question comes to us from Arlo, who asks, "Dr. Brusovanik, I've been diagnosed with ankylosing spondylitis. I can barely spell it, much less pronounce it. I'd like to know, what is it exactly? And does it seem to affect men more than women?" Great question, Arlo. Let's talk about this tough to pronounce but fairly rare condition. Ankylosing spondylitis is an arthritide. It's a condition where your body essentially attacks various elements of cartilage and other joints. There is a blood test known as HLA-B27 that is done to prove whether you have this diagnosis or not. And the presentation you'll find is something very common. You can't seem to stand up straight. You're battling gravity, you get up from the seated position, and you just flexed forwards. Patients who have ankylosing spondylitis have bone that's growing on top of all this inflammation. And it's important to address this problem early on, because the end point is that the entire spine solidifies as one long bone and predisposes patients to having fractures, as well as limits their mobility. If you've been diagnosed with ankylosing spondylitis, the right answer, Arlo, is to speak to a rheumatologist. And it will be very important that that rheumatologist hears you out, specifically hears out what you are complaining of, if you are at all. I hope this gives you some insight. Next up, we've got another question from allhealthtv.com. You should really check out our site when you get a chance. It's chock full of great information. Nikki asks, hi, Dr. Brusovanik. My husband has been recently complaining about shooting pain from his butt down through his legs. He won't go to the doctor, but could that be a symptom of something serious? Nikki, I'll be honest with you, it's kind of hard to diagnose without actually seeing your husband in person. But if I was to hazard a guess, what you are describing, what your husband is describing to you, is essentially sciatica in a vernacular, or nerve irritation. If your husband has compression inside his spinal canal, if one of the discs has become so wide as to obliterate the space for the nerves, or if there's something else in the canal that makes it tight for the nerves, normally a very roomy area where nerves can float within a cerebrospinal fluid, when those nerves get compressed, you start to feel pain going down the legs. Your husband needs an MRI. And this is not a rare problem. Don't catastrophize. Chances are this is not something dangerous. But again, it's hard to tell you without seeing your husband or seeing his MRI. I'd be happy to take a look if you want to send it to me. This next YouTube question comes to us from Aurora. Hello, Dr. Brusovanik. Do men tend to have more back pain and back issues than women as they get older? Aurora, that's a tough question. There's really no evidence that men have more back-related issues. There is some evidence that women get more osteoporosis, which means that women do tend to get more osteoporotic-related fractures. Now, men do tend to delay care more than women in some age groups, but let me tell you, those patients of mine who are moms, especially moms of multiple children, that's who really delays their care. No one else will answer a question about when was the last time you remember having a day with no pain. No one else will think about that question and say, legitimately, I don't remember, other than moms. So I don't think it's really as relevant which gender is associated with more back pain. But I would hone in on the issue that what you need is to know why you are suffering. You need a diagnosis. It's the only way to really get reasonable care and have reasonable expectations that established, scientifically established and verified treatment will actually help you. So instead of wasting time on try this and try that, if we get a diagnosis, we get an MRI, we get a proper evaluation, then you have a really good chance of getting that back pain, that neck pain to disappear just like you would any other pain. Aurora, I hope that my answer helps. Levi just sent us another YouTube question. Levi asks, Dr. Brusovanik, I'm an accountant, so I spend a fair amount of time sitting at a desk. I've heard a rumor that this can possibly lead to long-term spinal issues. Is there any truth to this? Levi, that's a great question. In terms of rumors that are true and not true, this one is definitely not true. But almost everyone believes that sitting is the cause of their pain. Let me explain. Imagine you obtain that diagnosis by going to a specialist, a spine specialist, and you find out that you have a degenerative disc. Now, degenerative discs hurt more when you bend forward or when you are in flexion, as in when you are sitting. So when you sit, you put more pressure on the disc, and if that disc is somewhat degenerative, doesn't normally hurt you, by putting pressure on that disc, it may provoke you to have pain. So the sitting isn't necessarily the problem. It doesn't make your problem worse, but it does elicit the pain from the painful disc, just as running would produce pain in an arthritic knee. Everyone thinks that it's their sitting job. And by the way, standing desks do help because they limit the amount of time that you sit. But if you're suffering from sitting, as so many of us do, once again, you need to see a specialist, obtain an MRI, get an evaluation, and get at that core of the problem, get at the diagnosis, find out exactly why you're hurting. From that point on, you have a legitimate chance of getting better. I hope this helps. Thank you for this question. Our next spine-related question comes to us from Stephen, who reached out via Facebook. Stephen asks, hi, Dr. Brusovanik, please explain the difference between degenerative disc disease and herniated discs. They're both disc-related, but they're different conditions, right? Okay, that's a great question, Stephen. So, a degenerative disc is what we all get. As we age, all our discs, just like our joints, knees, hips, will degenerate. Degenerative disc disease is when you actually start to have pain from those bad discs. Remember, not everyone suffers from all their bad discs. And unfortunately, with all the science out there, we don't understand why someone can have a horrible looking MRI and have no pain, whereas someone else will have some signs of degeneration, but they'll be in agony, suffering, needing surgery. So bottom line is, a degenerative disc problem, a disease, is when you suffer from bad old degenerative discs. Now, how do you suffer from degenerative discs? Sitting pain, it's hard to stand up straight. Once you stand up and you warm up, it gets better, but then when you stand, it gets so bad you gotta sit. Now compare that to a herniated disc. This is usually a younger patient, somebody who has an acute onset of pain, meaning suddenly, with no history, the pain just gets worse or gets bad from nothing. They'll have pain when they cough or sneeze, and when they do get that MRI, on their way to obtaining a diagnosis, the MRI will show that one of their discs tore, a little piece of that disc snuck out and is now sitting in a canal. Now, a degenerative disc is kind of like a jelly donut that you keep stepping on. It gets flatter and wider. A herniated disc doesn't have to have that component. It just has to have a tear with a part of the nucleus of that disc that comes out and usually irritates a nerve, causing that same old sciatica. Now listen, the distinction between these two conditions is very, very important. And the reason is because you can't have a discectomy when you have a degenerative disc. Cutting out a little pie slice from a squished down donut will not help you. And as a revision specialist, the number one error that I see in care of my patients who come to me after failed back surgery is that they had a degenerative disc and they underwent a discectomy. Now, a herniated disc deserves a discectomy, meaning for a surgeon to sneak in very carefully and remove the piece of that nucleus of the disc that snuck into the canal. These patients will go back to normal life immediately after a discectomy. And to those of you who are listening, who have a degenerative condition, who have undergone a discectomy and continue to suffer, you need to know that you are not alone. There are a lot of patients like you, and just like everyone else, you definitely need to get an MRI. I hope this answers your question. We have another one from Ellie, and Ellie sent one from allhealthtv.com. Ellie asks, Dr. Brusovanik, what's the biggest myth about back pain in men? Okay, men in general, just like women, will oftentimes present with sciatica and back pain. And men, just like women in general, will often blame themselves or assume that their daily chronic back pain is just their normal back pain. The biggest myth about back pain is that there is a thing known as normal back pain. There's no normal back pain. Back pain is common, and you often meet people who live with back pain. But just like any other pain, no pain is common, no pain is normal, and there's no such thing as normal back pain. If you have back pain, once again, you need a diagnosis. You need to get an MRI, you need to see a specialist, and then you got to find out exactly why you're hurting. Thank you for this question, Ellie. Our next question is from Nevin, and he sent the question via Instagram. Doctor, can poor posture really have an adverse effect on your spine? Nevin, I love this question. Everyone who is goal-oriented blames themselves for their aches and pains. Stop it. You are not in control of your posture. My mom, as a typical Russian immigrant, would shove her thumb in my lower back so that I would sit up straight. And even though I took that because I didn't know any better, now I can tell you in retrospect, that was all a waste of time. You're not in control of your posture, no more than a building is in charge of the rebars that hold it in concrete. If you are in pain, then there's a reason for it. And when you're in pain, oftentimes you tend to slouch more. When you are in pain, you tend to shift and change your positions more. You may want to lean to the side. So if you are in pain, it's not you or your posture that's to blame. Your posture is a result of your skeletal structure. Your posture is a result of your skeleton, of your discs, and of your bones. And with pain, you may have a worsening of your posture. Those of you who have neck pain will find themselves frequently sitting in a forward flexed posture. It's not because of that you have neck pain. You have neck pain usually because of disc or bone related issues. And that's what results in a change in your posture. Don't blame yourself. Just like all of our listeners who are in pain, if you have pain, we need to get the answer to the most important question of why you are suffering. We need to get at that diagnosis. We need to get you that MRI, and then you have a legitimate chance of getting better. Great question. The next question is from Jensen on YouTube. Hello, Dr. Brusovanik. What's one daily habit that can reduce back pain? Love that question, Jensen. The number one best habit is to do your abs. Now look, if you have back pain, crunches may be hard, do leg lifts. In fact, leave one of your feet on the bed or on the floor while you do a single leg lift. You'll find that your agility is better. You'll protect your back from having more back pain because you will have better mobility and you will have an easier way to get up from that chair, as so many of my back pain patients complain as being one of the hardest thing, changing positions. Jensen, I hope this helps. Our next question is from Richard. Whenever I lift weights at the gym, I always get back pain for a few days. I'm so sorry. Our next question is from Walter. I've been diagnosed with arthritis in my neck. Been having nerve pain that can go from my neck down from the arm, but it's only on one side. Anytime I apply pressure to the elbow, I get numbness and tingling sensation going down my arm. They want to do surgery on my neck. Do you think that that's an option? Walter, that's a very, very important question. A surgeon, before offering your surgery, has to be dead certain where your pain is coming from. And if there's one theme to our whole discussion today, is that if you have pain, you need a diagnosis. You need a reason. You need to know the reason why you're suffering. When you press on your elbow, if you're pressing behind that funny bone, and if that causes you to have symptoms, you may have what's called cubital tunnel, which is a problem that's not in your neck. It's far from your neck. It's a problem in your elbow. Now, in order to diagnose that problem, consider going to an upper extremity specialist. There are studies known as nerve conduction studies you can obtain, but they are really only reliable if you have numbness, constant numbness. Or you can check out pillow4pain.com and buy this nighttime brace, which will help. But before you jump into surgery, you got to make sure this is coming from your elbow or it's coming from your neck. Now, a neck MRI will definitely help you get at the root cause of your answer, a root cause of your problem, but you need a physical exam. If compression of your elbow causes peripheral symptoms, then indeed it's your elbow, and operating on your neck will do nothing, as I've seen so many of my patients who fly to me after failed surgery. If you have pain, you need a diagnosis. You need an MRI, you need a proper evaluation, and once you know the cause, you can have a legitimate chance of getting better. I hope this helps, and see you at the next episode.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.